Hello, good morning everyone. Today we'll be talking about one of the most important and most deadly diseases, which is announced as a pandemic whole worldwide in the late 1980s. And this disease is nothing but known as HIV infection. HIV infection stands for human immunodeficiency virus. Okay, and it leads to severe types of diseases or secondary co-infections when the virus become uh, unintentionally very much stable in the immune environment and tends to produce a lot of life threatening infections and cancers and many other disorders that are very rare to observe in a healthy individual. Now, the symptoms of HIV, you can predict from your own knowledge that there is a lot of night sweats and then a fever of more than 6 months, and that is arousing gradually and and more. Here in the slide, I have given you a brief preliminary knowledge about the HIV infections, which you guys will be knowing and must be knowing. Now, on the skin portion, I will be mainly focusing on Kaposi's sarcoma, and then we have papillonecrotic tuberculosis. In papillonecrotic tuberculosis, I have earlier said the slide in which it has been associated with HIV infection. Then herpes zoster ophthalmicus, and you can say herpes zoster skin lesions forming shingles, and that shingles are very much dangerous. Now, in neurological section, we have plenty of disorders and diseases associated with HIV-1 manifestation in the body. So basically, you guys need to have a preliminary knowledge about the HIV infection. I will post detail video, means and including all the uh, diseases and comorbidity related to HIV infection. Here in the slide, you will get a basic idea about how it approaches the body portion and the organs, and how it tends to damage and produce dangerous pathogenic effect on the body and leads to diseases that are of rare origin. Since it is a highly stigmatized disease, it has very much strangling, and you can say confusing mechanism in our body, how to try to initiates its pathogenicity in the healthy living tissues of the cells, how it disrupts the immune environment. You can see it by just focusing on the slides. It is very uneasy to understand this disease in the very first slide presentation. This slide is meant to just make you understand and create curiosity about the disease and its progression into the human body. And this is just for educational purpose and for the students who are preparing for various medical entrance examinations, and who are research driven people who have a few understanding about HIV disease and have a few knowledge about uh, HIV disease, HIV infection, and the dissociated disorders in that. Meanwhile, I have also included some of the diseases associated with HIV infection as due to the unprotected sex. Okay, so what are the types of diseases and how it spreads and how we can reduce those types of diseases, and what are the precautions, and after the diagnosis of HIV infection, how can we take post exposure prophylaxis treatment in the hospital, and the basic guidelines and rules uh, for the treatment. Meanwhile, the protection part during the sexual contact with the partner or in terms of intimacy, you must have earlier read the guidelines regarding the condoms use, and how to use it in a proper way, and how to dispose it and create and lessen the amount of progression of biohazardous diseases. So it is very much important that the paramedical students, such as nurses, clinicians, pharma students, can also gain a lot of knowledge from this slide. And I hope that if this slides gives you people a little idea about what's going on uh, in the world of so much uh, urbanization and so much development. But this pandemic and the education about the disease is still a very much cause of concern in the coming era. So basically, in layman sense, I mean to say that people of a normal community who are not so educated and medically not so sounded or well grounded in their profession, they can also build a basic concept after having through this slide, and they can bring a lot of curiosity to understand how diseases progress. Okay, so right now in the slide, you must be seeing that various tons of diseases have been passing on to under your vision, and you can see how this little slide can give you a brief insight about the procedures and the guidelines and main causationary factors that are responsible for the declination of HIV infection as well as other sexually transmitted infection. Okay, so you must go through this slides so that in order to understand it in a very better way, you can be